When was the last time you actually washed your hands for 2 minutes? Why does washing your hands even matter so much? What's the difference between antibacterial soaps, antibacterial hand sanitizers, and regular soaps? And which time and which place should I actually use them? Well, we are going to give you the answer to all of those questions because they are very prevalent and important as we become nurses. And even more specifically, we're going to focus on the importance of hand hygiene.
As future nurses, washing our hands will soon become a more crucial step in our daily routine.
And we were interested in knowing how soap works to keep ourselves safe
from infections or diseases when helping patients in hospitals or healthcare settings.
The compliance of nurses with their hand hygiene is shown in the following figure.
Graph A demonstrates how often the different professions within a hospital comply with hand hygiene. It is clear that nurses, the ones who are the most interactive with patients, are the most compliant with disinfecting their hands before and after coming into contact with patients. And over here, we have Graph B. Graph B demonstrates different scenarios and the level of compliance in which professionals use hand hygiene. Scenario 1 was before any patient contact. Scenario 2 was before an aseptic task. Moment 3 was after risk of exposure to body fluid. Moment 4 was after patient contact. And moment 5 was after making contact with the patient. Based on the graphs, an assumption can be made that healthcare workers use hand hygiene mostly when they are exposed to patients and can put themselves at higher risk of a disease.
Since 2800 BC, when soap was discovered, till today, soap has become a key strategy of infection control. Surprisingly, it wasn't until the 1980s that national hand-washing guidelines appeared and were accepted as a way of prevention of healthcare-associated infection. In the past 40 years, it has been an extremely important tool for preventing disease. What is the structure of soap and how does it work? Did you know that using regular soap and water is the most effective way to remove germs and dirt from the body? When greasy dirt or oil is mixed with soapy water, the soap molecules arrange themselves into micelles. First, the hydrophilic part of the soap molecule sticks to the water and points outwards, forming the outer surface of the micelle. The hydrophobic parts points to the tails, stick to the oil and trap oil in the center where it can't come into contact with the water. With the oil tucked safely in the center, the micelle is soluble in water. As the soapy water is rinsed away, the greasy dirt goes along with it. Due to the fast-paced job of nurses who did not always have time to complete the recommended 2-minute hand washing procedure, they began using hand sanitizer as an alternative. Hand sanitizers can also be referred to as ABHRs, alcohol-based hand rubs, because they are 70% alcohol-based. The alcohol works by dissolving and breaking down the outer membrane of a cell, which in results kills the bacteria. Many companies advertise antibacterial soaps as more efficient and better. However, the FDA in 2016 actually banned antibacterial soaps and over 17 chemicals in them. None of these companies could actually prove why antibacterial soaps were more efficient than just regular soaps, and they found many harms to the environment and to humans. This is why hand sanitizer should only be used in clinical settings, or if you're in a big rush. Even though soap has helped improve healthcare-associated infections, there's still a very big issue today because of antibiotic resistance. If we just wash our hands, we can avoid the use of antibiotics and then antibiotic resistance occurring.
As you can tell,
The best way to stay clean and protect yourself from all the gross germs out there
Is to do your classic 2-minute routine with soap and water.